Hi everyone, Dr. Carling here for a quick dive into primary aldosteronism, PA or Conn syndrome, and the role of pills, medicine, and non-surgical treatments. So primary aldosteronism, PA, what's the role of pills and medicines and non-surgical treatments? So let's get right to it. Think of pills and medicines like a band-aid on a bleeding artery. It might slow down the bleeding, but only surgery, meaning removing the tumor in this case, truly fixes the problem in most cases. So at the Carling Adrenal Center, we focus on fixing the problem, meaning removing the tumors, not prescribing medical drugs. So always consult your medical doctor about medical treatment options. But medical management is critical in specific scenarios, often relying on two key drugs. The MRAs, meaning the mineralocorticoid receptor antagonists called spironolactone and eplerenone. Those are the two most common, spironolactone and eplerenone. And those two medications block the effect of excess aldosterone, the hormone driving PA, to control the high blood pressure and the potassium levels. And spironolactone, while effective, has some side effects that are important to know about, and that has to do with the estrogen effect, the female sex hormone effect of spironolactone. So that can cause breast tenderness or enlargement in men, what's called gynecomastia, meaning the breasts are growing, and irregular periods in women. And it also can cause a lot of fatigue, and obviously in a man with the estrogen effect, that can significantly hamper the sex drive, as well as cause problems with erectile dysfunction. So that's important to know about. The eplerenone is more selective, doesn't have the same estrogen effect, but it's not as effective in the treatment of PA. And it also can have side effects like dizziness and headache and so forth. So you need some careful monitoring while on these drugs. So when are these drugs used? Well, first for patients until surgery, unfit for surgery due to other health issues, so the general anesthesia is too risky. Maybe most important, to get control of the primary aldosteronism before surgery, so as a bridge to adrenalectomy in most patients, and especially for those patients that are morbidly obese, so they need to lose a significant amount of weight before they can have surgery. And in those scenarios, going on those medications before surgery is very helpful. And fourth, for patients that don't have access to an expert adrenal surgeon, which is absolutely crucial for effective adrenal surgery. And finally, for those patients where the life expectancy is very short, maybe 6 to 12 months, maybe they have stage 4 cancer or they have very significant cardiac disease, it can be helpful to treat those patients medically. So while spironolactone and eplerenone are vital for managing symptoms, side effects, especially the spironolactone's estrogen effect, requires careful consideration. So again, the Carling Adrenal Center is not a medical drug prescription practice. We cure patients by removing the problem, removing the tumor. But speak to your medical doctor about these medical treatment options. The mini-back spironolactone remains the gold standard for curing primary aldosteronism once and for all. So thank you for watching, and continue to stay intellectually curious.